Hello, everybody. This is Debra Ness. I'm president of the National Partnership for Women and Families, and very excited to be here to discuss this comprehensive and insightful paid leave research, which is just so timely for the conversation we're having in our country today. In just a few minutes, I will be turning this call over to Dr. Jody Heymann, who is founding director of the World Policy Analysis Center, Dean of the UCLA Fielding School of Public Health, and also author of the new report we'll be discussing today. In addition, we have with us today U.S. Representative Rosa DeLauro, who is the lead sponsor of the leading paid leave proposal in Congress, the Family and Medical Leave Insurance Act, better known as the Family Act. And also speaking with us today will be Rosemary Arriada-Keiper, who is Vice President of Global Rewards at Adobe. And Adobe has endorsed the Family Act and is a powerful business voice in the push for meaningful national paid leave law. So we have an exciting lineup for you, and before I hand it over, I just want to make a couple of points. As a nation, we're in an extraordinary and long overdue moment of reckoning about gender equality in our workplaces. And as we take a closer look at the forces behind the biases and discrimination that hold women back, we are having an unprecedented and bipartisan conversation about one of those key forces, our nation's lack of paid leave, and the recognition that the lack of meaningful national paid leave is one of the most significant barriers to women being able to achieve economic equality. Right now, 85% of U.S. workers, and that's more than 100 million people, have jobs that don't offer paid family leave. And more than 60% don't even have paid medical leave through an employer-provided disability insurance plan. Lawmakers and their advocates in 5 states, California, New Jersey, New York, Rhode Island, Washington, and the District of Columbia, have sought to change this by enacting their own paid family and medical leave programs. And businesses of all sizes, like Adobe, are doing the same by establishing strong policies of their own while also endorsing public policy because they recognize the business benefits of all working people and family having access to paid leave. But as the data and stories of people across the country clearly show, there's just tens of millions of people who don't have access to paid leave. And women, especially women of color and those in low-wage jobs, suffer the most. That's why the National Partnership and the National Coalition we lead have been pushing so hard for a strong national paid leave plan that builds on the lessons we have learned from state programs and from private sector employers. But as public awareness of the discriminatory impact of this deficiency and its huge human and economic cost grows, the ground is shifting. And I'm proud to say that we've now reached a point when the question is not if, but when the United States will enact a national paid leave plan. As folks have become more aware, we are now engaging in a remarkable bipartisan discussion of this issue. And it has generated a very welcome and important soul-searching about what a national paid leave policy should look like. We know the details matter tremendously, which is why this research is so important. We cannot squander this opportunity with half-baked proposals that simply allow elected officials to check a box while providing little or no meaningful change. And that is why Dr. Heymann's findings are so critical. We need national paid leave policy that is grounded in research and evidence, and this new report is a significant addition to that body of work. By making specific recommendations based on thousands of studies, evidence, and lessons learned here in the U.S. and in other countries, the report lays out a clear framework for the kind of policy that would be sustainable, effective, and meet the needs of families, businesses, and our economy. Dr. Heymann is not new to paid leave, In fact, she has been leading teams studying paid leave for 17 years, and she is the one who conducted the groundbreaking research we still refer to today when comparing the U.S. to other countries. So it's truly an honor to introduce Dr. Jody Heymann, Founding Director of the World Policy Analysis Center and Dean of the UCLA Fielding School of Public Health. Dr. Heymann, it's yours.
Thank you so very much, Debra, and thank you to everyone for joining us. It's a pleasure to be with you. We did a year-long study with 12 researchers diving in depth to try to answer two fundamental questions. First, what's needed? What kind of paid leave is needed for the health of individuals and families? And second, how can we make it economically feasible for Americans to take it and for the country to afford it? We did 3 new major studies to accomplish this. First, a systematic analysis of all the research evidence across the United States and across all high-income countries on paid leave, reviewing over 5,500 studies. Second, a deep dive with medical experts into the medical evidence on what's needed for leave. And third, a new look at across the states and again across high-income countries at how the mechanisms of paid leave affect economic outcomes. So the evidence is substantial. We've found that all 3 elements matter for paid leave: parental, personal sick leave, and family sick leave. For parental leave, the evidence is strong that 3 months is an absolute minimum of what's needed for the infant's health and for the mother's health, for physical recovery from delivery, for promoting breastfeeding, which is a life-saving and life-enhancing intervention, as well as for both parents bonding and the economics of the family. When it can be increased to 6 months, as it is in the majority of high-income countries, health outcomes for families improve and economic outcomes improve. When it comes to personal sick leave, for some of the most common major illnesses in the United States, like cancer treatment, 6 months of paid personal medical leave is important. Radiation and chemotherapy treatment commonly last 6 months. If we can get to 3 months will cover a number of major illnesses. One example is acute myocardial infarctions, or what's commonly referred to as heart attacks. These typically 4 weeks for hospitalization and acute recovery. How much longer beyond that depends on the physical labor of the job and the extent of damage from the heart attack. Similarly, when you look at sick leave, 3 months of paid leave for family members would make a big difference. What do we know there? We know that caring for children makes enormous difference if parents are there, and it's often essential. Hospitalizations alone for complicated congenital heart disease can take 5 weeks. Children with cancer typically have 3 to 6 hospital admissions per year. And as the country ages, elderly adults, 65% of them leave the hospital without having recovered their full functional status, needing help of family members. Finally, at end of life, we have over 1 million Americans each year who go into hospice. Much of that hospice care happens in the household. The duration is typically less than 6 months. The median is 17 days. Family members being there for that makes a profound difference. So I want to highlight 2 other aspects that I think are central besides the duration from the research evidence. One is that higher wage replacement rates matter. 66%, 80%. The higher it is, the more it makes a difference to both men and women being able to take it, and the higher earner in the family, which still more commonly is the man than the woman, but when it's the woman, her being able to take it, at that 80% rate. Also, the 80% rate making an enormous difference to keeping families out of poverty at these critical times when someone's sick or when they have a new infant in the household. Finally, what did we learn about coverage? And here I think there's important evidence from other countries about how well we can do. 4 out of 5 countries cover the self-employed. Nearly every country covers small businesses. So 31 OECD countries, the high and middle income countries in the case of Mexico, which is one of the OECD, they do not have opt-outs for small businesses. Only 2 countries do, and they still have a way to cover small numbers of employees. 6 months may sound like a lot in the context of the current debate. I will say that overwhelmingly these are amounts of leave that all of our high-income countries, high-income countries that look like us do give both for paid sick leave and paid parental leave. Again, 3 months would make an enormous difference, but anything less than that risks the health of many. So I want to just close here so that we have time for questions, but before I do, I just want to say it's really an honor to be on this call with Representative DeLauro, who has led the Family Act and these important steps forward, and with Rosemary Arriada-Keiper, because the kind of advances that both Adobe is making as a company, while at the same time recognizing the importance of the Family Act and similar legislation, which has adequate duration, adequate wage replacement rates, and really tries to cover all Americans, is exactly where the evidence sits and so important for our future.
Thank you so much, Dr. Heymann. Your findings are so compelling, and they really do reinforce how far behind the United States is on this issue. But your research is giving us the evidence that we need and can build on to shape much more meaningful policies in this country. And I know you only scratched the surface of what you found. There's so much more to the research. So I would like to urge everyone to please check out the full report and the accompanying policy briefs that can be found at worldpolicycenter.org. Now I'll repeat that. It's worldpolicycenter.org. Now I'd like to turn it over to a true champion for women and working people in Congress, a woman who has known the importance of this issue for decades, has lived the importance of this issue herself, and who has untiringly been leading the charge for real paid leave in the U.S. House of Representatives, Rosa DeLauro. Rosa.
My gosh, thank you so much, Debra, and thank you, Vicki. I know you're there, but Dr. Heymann, what rich data you provide us so that we stand so tall in this effort. And, you know, to you, Rose, as well, thank you for being, I'm excited about your leadership and what Adobe is doing. And this comes at such an important moment. And as both Debra and Dr. Heymann have noted, it is timely. The folks on this call, quite frankly, have been laboring on this issue for many, many years. And to see that the debate around paid family leave really is at the center of our public discourse gives us great confidence that this is the moment where we push forward and we can achieve, which is something that is so important for families. It's not just about women. This is about families and what their struggle is, what they go through, and the necessity of this kind of public policy, which then, in fact, becomes a new social safety net, part of a new social safety net for families in times of difficulty. So the research from the World Policy Analysis Center really it supports the fight for something that's robust, the National Paid Family and Medical Leave Program. And I especially want to recognize, again, my friend and my sister in arms, Dr. Dr. Jody Heymann, I've been so grateful for your expertise and your willingness to collaborate over the years. It was your research that has been the cornerstone of my work and the late Senator Ted Kennedy's work on paid sick days. And over the years,
so much.
Oh my gosh, please, you stand with the Titans in what you have accomplished. We've often highlighted that the United States shares the dubious distinction of being the only country without maternity leave with Papua New Guinea, Swaziland, Lesotho. And Jody, that's important when we stand up to talk about that. But what a great deal of dedication that you've had to improving the quality of data that we have at our fingertips. And there again, what is so striking about the data is this is not anecdotal. This is the reality. So when we are speaking from real strength when we speak from this material. National partnership, my God, where would we be without you and the fight over the years? So I am proud to fight by your side on this and the other issues that affect our economic security. Again, Adobe, you lead the way. This is, paid leave, in my view, is more than a public policy proposal. This fundamentally changes people's lives, and I do know this firsthand. As Debra pointed out, in 1986, I was diagnosed with ovarian cancer. I worked at the time for Senator Chris Dodd. I was a staff person. Husband and I had 3 kids that were in school. When I went to tell the senator that, what my medical situation was, he responded by saying to me, Rosa, just go get yourself well. Your job is here. He was about to embark on another Senate run. And he said, we don't start the campaign until you come back. So I was very fortunate. My employer offered paid medical leave. And so with that, as not being a part of the stress of my life at that time, trying to cope with a cancer diagnosis, and the support of colleagues, my family, and I recovered cancer-free now for 30 years. So I was fortunate. But it shouldn't be just, a staff person who works for a United States Senator or a United States Senator or a member of Congress. Most working Americans are not so fortunate, and this is not how it should be. You have just 13% of the private sector workforce has paid family leave through their employers. We need paid family and medical leave to help address the greatest economic challenge of our time. Too many Americans who play by the rules. They are in jobs that do not pay them enough to live on. They struggle. And with rising costs everywhere. But the World Policy Analysis data shows that low-wage replacement rates make it difficult, sometimes impossible to take leave. In fact, it increases the likelihood that families will fall into poverty if they do choose to take leave, which is why we need to pass the Family Act, a bill I am so proud to be the lead on in the House, and we have Senator Gillibrand from New York in the Senate. And what the bill does is sets up a national insurance program to provide participating workers with up to 12 weeks of paid leave per year for birth or adoption of a new child, recovery from a serious illness, or caring for a seriously ill family member, with contributions both from the employee and the employer. This should not be borne by one party or another party. The research we discussed today shows that countries have demonstrated the ability to provide prolonged leave through social insurance programs, like this one. And I welcome my colleagues on the other side of the aisle to the table on this important issue. But the proposals we have seen don't go far enough, in my view. I'll be clear. Any proposal that stops short at parental leave only, like what's being proposed, or does not cover at least up to 12 weeks, or does not have a stable financing mechanism, is insufficient. It is not going to help workers. In fact, you have 75% of people who take family and medical leave currently do so for reasons other than for the birth or adoption of a child. We need a policy that includes paid time off to care for a seriously ill or injured family member. That includes parents and children, as well as for workers who may have a serious health issue, for military families, not just for the birth or the adoption of a child. And that's what Dr. Heymann's new research highlights. It's this point that legislation on paid leave should be inclusive of all families. It should support cooperative care. It should reduce the burden on both the caregivers and their employers. So the research we see today supports a minimum of 3 months of paid parental leave. I understand the 6 months, but we are at 3 months, and you make the case for moving to 6 months of paid leave for both health and economic benefits for American families. I'm not sure the market here in the current environment where we could move to 6 months, but we sure as heck can move to 3 months. In the U.S., we are starting from a national policy of 0 days. Imagine. So we have a long road ahead of us. We know that. And I think of the bill that I've introduced and that Senator Gillibrand has introduced as setting a baseline, one that working families deserve and they desperately need. You know, paid family and medical leave is an idea whose time has come. I have fought, I will continue to fight to ensure that access to paid family and medical leave should be a fundamental right for all workers across this country. It's not about a lottery where based on where you happen to find work or the goodwill of an employer to do this, like, you know, my employer and, you know, Senator Dodd has a long and rich history of family and medical leave as well. We knew at the time we couldn't deal with paid family and medical leave, but the time has now come for us to do this. So I'm so grateful to everyone on the call, and I thank you. And with that, let me just turn this back over to Debra.
Thank you so much, Representative DeLauro. I know that with your leadership, we will prevail, and we will ultimately have a policy in this country that supports all families, and especially those who struggle the most and face the greatest barriers in low-wage jobs. So I am now really excited about introducing Rosemary Arriada-Keiper of Adobe, because she is the person keeping us honest and showing that this can actually be done. And even among tech companies, Adobe is a leader with respect to the comprehensiveness and the duration of the paid leave policies that they are offering. I think you will all be impressed as you hear about them. And on top of that, I want to say that Adobe has taken the step of also supporting the Family Act. That takes great courage. It takes real leadership. Adobe is one of almost 90 companies, large, medium, and small, who have added their voices of support to the Family Act because they know that it is the right thing to do for their own employees, for their own business, but also for our families, our communities, and for our economy as a whole. So I turn it over to you now, Rose. Thank you.
Thank you, Debra, so much, not only for the introduction, but again for the reminder of the importance of this topic and for allowing us to be part of this discussion. Also to Dr. Heymann for the research that you have been doing and continue to do. It certainly helps us from a business perspective as we make the business cases to our leadership around the importance of this. So these types of studies are undeniably helpful to us in terms of the movements we have internally when trying to push these types of benefits for our employees. And to Congressman Rosa, thank you so much for continuing to have a ton of passion around this, your leadership in continuing to push, and the fortitude to really drive this discussion on a national scale, and really do ultimately what is, I believe, the right thing for the the companies and the nation to be doing. It's not just a matter of should we be doing this, but it is really the right thing to do. So with that, let me share a little bit about Adobe's journey and kind of why we did this, the types of programs that we provide, and some of the results that we've seen as a result of the benefits that we offer. So Adobe ultimately believes that by helping our employees, we help our business. It's what helps us to attract and retain employees. It helps us to support working families and ultimately really contributes to an overall diverse workforce. We believe that when employees have the ability to care for themselves and their family members at home, it allows them to be their best at work. In 2015, we started our journey to enhance our programs, and we really wanted to look beyond just the statutory or mandated requirements. We took this journey, and it wasn't only a U.S. journey, it was an actual global journey that we took. Today, we provide up to 26 weeks of paid parental leave time off for parents to either recover from the birth of a child or to be able to have time to bond and spend family time with their children, whether through birth, whether through adoption. We also provide a paid family leave up to 4 weeks, which allows people to take time off in the event that they need to care for themselves or their family members. In addition, we do have a medical leave program that provides for up to 10 weeks of pay at 100% for up to 6 months at 66 2/3% of their income, and for up to a year of income replacement at 50%. So we do believe that people need the time to recover and that that time should be paid for. We also provide a global bereavement program of up to 4 weeks for people to take in the event that they have the loss of a family member. We also have a welcome back program, which allows people who have been on a leave for an extended period of time to come back and transition back into the workforce after being gone for such an extended period of time. We recognize there's inherent challenges when people are returning from being gone so long. All of these are global benefits, with the exception of medical, due to many of the statutory requirements outside of the U.S. We've had to kind of accommodate and align with some of those requirements. But generally speaking, these are programs that we offer on a global basis. We recognize that outside of the U.S., most nations actually do have a mandated paid family leave program. The U.S. is one of the only among 41 nations that does not have anything. But as we even began to look outside of the U.S. and we started to look at the mandates, we recognized that given the income levels of our population, oftentimes these mandates were not sufficient to assist them with the financial responsibilities that they had. And so we took an initiative to establish a global standard in terms of what we wanted relative to these benefits that aligned and matched the income levels to which our employee populations were earning. We are, as a result of these benefit programs, we've seen a tremendous amount of retention. In 2017, when we looked at our statistics for the U.S. alone, we had 372 employees that went out on a leave, and we had a retention rate of 94%. This is huge for Adobe. What we often found was that because of the financial hardships associated with people trying to raise their families and spend time with their families, that they were making the decision ultimately to have to come back to work sooner than they would have liked. And so as a result of that, we really looked to enhance some of the financial support that we were providing. And what we're seeing now is people are taking the time to be at home, and when they're ready to come back, they're very grateful. They're extremely positive about the financial impact that this has had to them. And thrilled about the fact that there's actually an employer that really cares about their well-being. And let me tell you, it becomes very pervasive. Word of mouth, the brand, and the recognition that we are given as an employer by these employees who have had such a positive experience is tremendous. And the PR that we get as a result of that in terms of our ability to attract and retain talent is amazing. People want to work for a company that cares about them. And we believe that these benefits that we provide signal a very strong message that we do. And again, it's not just about attraction and retention. Fundamentally, we believe it's really the right thing to do. As a company, we're thrilled to support and believe that the National Paid Family and Medical Leave Act is essential to working people, their families, and the economy. We recognize that not all companies and small businesses have the financial ability to be able to provide the types of benefits that Adobe does, which is why we believe this needs to be managed and supported at a national level. So again, thrilled to be a part of this. Fantastic that you guys allowed us to share our voice in this, and we continue to want to not only join but lead this movement and look forward to continued success as we move this forward.